What's up, fight fans? This is your favorite ringside physician, Dr. Jared Vasquez. UFC Fight Night 153 took place in Stockholm, Sweden. We saw Alexander Gustafsson take on Anthony Lionheart Smith. Lionheart walked away with a tremendous submission victory. But if you guys know any of my videos and have seen any of my content, you know that there's a medical takeaway that we're going to talk about. And in this case, we're going to talk about a post-fight injury in Lionheart's left hand. In the post-fight interview, we saw Anthony Smith talking about hearing a pop early on after a punch that he threw and landed on Alex. And afterwards, he heard his hand clicking and his bone moving in there, so he knew that his hand was broken. In this case, let's start with anatomy. What's the anatomy of the hand? Let's take a quick look. Let's interpose the video here with the picture. So you see that in the palm of the hands, we have the metacarpal bones. On top, we have the fingers that are made by the phalanges, and the wrist is not involved in this injury. Okay, so normally with boxers, we see the typical boxer's fracture, which is a fracture of the metacarpal bones at the distal aspect, far away from the wrist, at the distal aspect, and it's usually the fifth and fourth metacarpal bone. In Anthony's case, let's pull up the x-ray. In Anthony's case, the bone fractured in this case was the second metacarpal bone. That is one of the two fixed bones with less degrees of movement in the hand, and that would be the second and the third metacarpal bones that have approximately 15 degrees of movement. So they are the pillars of the hand, if you will. In the x-ray, we see that it's a mid-shaft fracture. It's not a neck fracture or a base fracture. So if we see the hand again, the base fracture would be closer to the wrist, and the neck fracture would be closer to the knuckle, if you will. In Anthony's case, was mid shaft, right there in the middle. It was pretty angulated, so it was not lined up. Sometimes you see the bone fracture and stay right there, that you could just align it, cast it, and take care of it. But in Anthony's case, it was at an angle. He's had multiple fractures, which puts him at risk, and kind of steers his treatment towards internal fixation with plates and screws. So let's take a look at how that surgery looks like in a small animation. So what the orthopedic surgeon does there is he gains access with the incision. The bone is exposed. A plate is put in place with screws or with wire, depending. There's different techniques here, but the gist of the surgery is that we're gonna help that bone stay aligned with hardware. We're gonna close it up and later remove or keep that hardware. In case of diagnosis, x-ray is sufficient. These guys, I mean, it's clinical. They're punching. It's a direct trauma to the bone. So there's absolutely no need for MRI unless there's an opening of the skin, unless there's other complications, infection, perhaps. We're looking at a period for recuperation of about maybe 4 to 6 weeks in case of a mid-shaft fracture. Is not the traditional boxer's fracture. So in a case like Anthony, we're probably going to see him out for 3 to 6 months with rehab and all that stuff that he has to do. I mean, he's right there at the top of the heap, so we wish him the best. So remember, guys, it wasn't the typical boxer's fracture. It was a mid-shaft second metacarpal fracture. That's a lot of words in there. Thank you for following my content. Stay tuned that we're going to be posting more frequently in the channel. This is Dr. Vasquez, and I'm out.